Thank you, Ashley, for being the hostess with the mostest. All right, well, welcome everyone to Rise and Thrive webinar series. You will be in the webinar today titled Student Accessibility and Mental Health Services, Leveraging a Relationship for Collaborative Advocacy. So whether you are a higher ed professional or a student, we welcome everyone, or just a coalition community member, we welcome everyone, because again, it's about campus and community partnerships. So just a little backstory, I do this every webinar. So if you've heard it before, just, tone me out. But Rise and Thrive is a project developed through funding from the Governor's Emergency Education Relief Fund under the Coronavirus Aid, Relief, and Economic Security CARES Act. Mental health coordination. OCI is housed at Prevention Action Alliance. And if you don't know what OCI is, it means the Ohio College Initiative for Student Wellness. And we are a partner in this project with the Ohio Department of Mental Health and Addiction Services, Prevention First, the Ohio Program for Campus Safety and Mental Health, and the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. So these Rise and Thrive webinars are developed to promote campus and communities working together and provide opportunity to engage with state and national experts on topics that promote campus and community partnerships and enhance student wellness. All webinars are free and CEs will be offered at every one. Webinars are the second Wednesday of each month through May 2022. So I believe that's 3 left. And then today we have some guest speakers with us to talk about the student accessibility and mental health services. I would like to introduce Emily M. Ribnik. She is the director of Criminal Justice Coordinating Center of Excellence at the Department of Psychiatry, Northeast Ohio Medical University, which if you weren't paying attention before, is one of our partners on this project. And then we also have Amanda Feaster. I hope I said that right. Okay.
Feaster, yep.
All right. She is the Director, Student Accessibility Services at Kent State University. Welcome, Amanda and Em.
Thanks, Juliana. We are super excited to be here. You heard our titles officially. We want to talk just a little bit about sort of our relationship and our working together model, so that it's something that maybe if it helps you all in your work as you're going through, whether you're a higher education professional, a mental health provider, or even just someone who is adjacent to those things, having this information we hope will help you feel a little more educated and empowered about it. I'm seeing some names in the chat, so I know we've got for sure some mental health providers that I am recognizing names of, and other university folks. So super excited to see all of you. Hello to our friends who came to see us today. Emily is going to share her screen, so I'm going to let her get started on our slides.
Hello, everyone. It's good to see your names since I can't actually see you today. So like Amanda said, today our presentation is on student accessibility and mental health services and leveraging that relationship for collaborative advocacy. And we'll talk about what kind of all of that means when you put it all together. One thing to note as we move to introduce ourselves is that if you're wondering why I'm here, since I'm the director of the Criminal Justice Coordinating Center of Excellence at M.Ed, is that I actually just started this position about 9 months ago and was previously with Kent State University at Stark's Counseling Services for 10 years. This presentation comes out of that 10-year relationship that Amanda and I had with, I believe I started in April and Amanda started in May. So we kind of came as a pair for better or for worse. And so a lot of what we're going to talk about really is that. So the history of our working relationship, like I said, really starts back at Kent State University at Stark. I was hired to be the clinical mental health counselor of counseling services, which at the time was being rebooted. They had had a mental health provider on campus before, but the office had been vacant for, I believe, about 18 months. When they hired me to basically reopen counseling services, revamp what they were doing. And then Amanda was hired in a month later for student accessibility services. And really the way all of this started was, one, you know, when you get hired closely together like that, you do end up naturally doing a lot of things together. Usually that's the learning piece of just what is going on here. But on top of that, we were also housed right next to each other. I think for the first few months, Amanda was in a different office. And then within 4 or 5, I was gonna say within 2 months of us each starting our jobs, she moved over into where my office was housed. So our office area had our shared secretary, and then student accessibility services and counseling services physically in the same place together. Some of the other things that we had together was we inherited a lot. And you know how inheritance goes. Sometimes it's great and shiny, and other times it's questionable and scraggly. And that was a shared experience that we had, was we inherited offices, we inherited how those offices functioned. And we also inherited the types of relationships that those offices had with students. So through this inheritance, we both really viewed it initially independently. And then when we realized we both thought of it this way, we really came together, was that this was an opportunity to really do something different that had not been done at the campus before. We, of course, worked on things between the two offices, but our relationship led to other changes, not only at the campus, but also at the university, which we'll start getting into now as we talk about where we are. So where I am now is at M.Ed's Department of Psychiatry, and I work in the Criminal Justice Coordinating Center of Excellence.
And I am now at the Kent campus of Kent State University. So while we don't officially supervise the regional campus offices of SAS, we do work very collaboratively together. So, and then because I'm at the Kent campus, I'm in meetings and in situations where I can talk about not only what we do for our students at this campus, but also what's happening for the regional campuses. We really like to show off our pictures from when we first started working at Kent Stark, in part because everybody sort of thought we were the same person. We also sort of look like two magazine pictures of a before and after of a hair color shot sort of thing. Yeah. But also we're clearly not the same person, as you can tell from these hilarious pictures. And so now, even though we are at now different institutions, and our jobs have changed pretty significantly since those days, and then I have continued to work together on different projects, obviously this, but also some other things as well. So we have different hair, we still wear matching outfits, even if we didn't mean to. And we don't see each other every day, but we do still sometimes share a little bit of a brain.
Yeah, and we'll kind of walk you through some of the different things that we're doing now, which actually even today, not just this webinar as an example, but also a different state level collaboration, which will be going on. So I'll let Amanda kind of walk us through what our talking points are going to be for today.
Yeah, so our hope with what we want to talk about today is to give you a model that's a flexible model. We want to talk about how it worked for us, but then also hopefully provide some space for you to think about how it can be something that might work for you in your situation, or if there are folks that you want to have a collaborative relationship with, maybe in SAS. I feel like if you don't work in student accessibility services, it's kind of it feels a little bit behind the curtain. You know, it's a different kind of place. We're not always sure what's going on back there, but it's important. So we want to pull back the curtain a little bit on that, and encourage you all to identify those folks on your campuses or at your institutions that it makes sense to collaborate with. So we'll do a little history of our working relationship, which Emily talked about why that relationship was important for us. Now we've done it for a while. It really seems like kind of obvious, but I also know that it's not necessarily obvious or encouraged at some campuses. we want to talk a little bit about the payoff. So if you are thinking, I need that kind of thing at my campus, we can maybe help provide some suggestions about why it's beneficial. So you can use that to encourage that. We want to talk about the benefits of collaborative advocacy. We have one student case study that is sort of always our go-to example of why this is so important. But over time, we have gained many more examples of that. And then some tips, just things we kind of figured out, sometimes the hard way, and sometimes just easily, that we want to share as you think about who your collaborators are, either at your campus, at your institution, or whatever work you're doing. And so this really is just like we said, sort of a flexible model. I feel like I should be using air quotes under model, because we really are talking a little bit about overcoming some of the tendencies for territorialism, whether those are things you may have because you have an office you need to protect, or in an era of limited resources, we often end up sort of on the negative end of here, do more things with less. Or other folks may just assume that there's territorialism because both of our roles have a level of privacy associated, and folks don't know how to navigate that. We're going to talk about our two offices specifically, but then taking that out more broadly. For us, the big keys of that were communication and intentionality. And so we hope that this feels sort of transferable and flexible enough to give you a sense of what could work for you, and to get your gears rolling, thinking about what could work, what you need to make those types of relationships work, and where maybe you've missed those opportunities so far and you want to put some energy toward that in your own roles.
So a little bit, as I talked about kind of the literal history of our working relationship, you know, it wasn't just meeting each other. It wasn't just being in offices next to each other that made the relationship. That really helped. I mean, I'm not going to lie, that convenience was, I think, a big factor in those early, probably the first very early 2 years of really checking in with each other very intentionally, very often, especially as things we were doing started to overlap. But on a more kind of set idea of the working relationship, some of the things that we realized probably about 2 years in was, and again, we went in there to do our jobs. This kind of working relationship and this kind of flexible model between accessibility services and student mental health services was not, I think, originally in our plan, right? It wasn't a goal to create this. This was something that happened out of need. And it was something that we recognized was very, very positive. So we were involved in system and structural relationships at the university level. And that's kind of where our relationship took us. Because we had that positive working relationship and we advocated for each other, and we'll talk about ways that we did that, you know, we were able to kind of raise both sets of services at our campus, but also at the university as a whole. We really had to create and maintain this relationship. It is work. I mean, there are still days when we don't agree about everything, and you have to put in the time to work through that, or else it really isn't a relationship. And I think that was one thing that, looking back now over that past 10 years, I really think about a lot, was the time that we spent really cultivating that relationship. Yes, on a personal level where we saw each other a lot and we talked a lot, but also on understanding each other, understanding where we were coming from a professional perspective, and how we were approaching student success, and realizing that we were both trying to do the same thing, right? Help students do what was best for them, help students be successful, and be in that place to help students get there. One of the things that I was able to accomplish through this relationship was Kent State University has a campus mental health coalition. And early on in my 10-year tenure with the university at Start Campus, I was asked to take over the leadership of the CMHC. One of the things that we did very early on was we brought together a very large group, which included SAS services, which it had not included in the past. to really look at what this group was and what did this group need to accomplish. And what this led to, honestly, was a lot of restructuring. And it was very positive. And having the input from these other offices that end up working with or seeing things, you know, from the mental health offices very frequently was extraordinarily helpful. One of the things that was also able to get started was to have a regional campus mental health clinicians meeting. One thing to know about Kent State University is we have 7 domestic regional campuses here in Ohio. And now all of those campuses have a mental health clinician. When I first started my position, it was Start Campus. Very quickly, right after, Salem and East Liverpool added a contract position. And then it was our College of Podiatric Medicine, and then Trumbull, and then the rest of our campuses came on board. And what we realized was those mental health clinicians really needed each other to talk through the different things that were going on, not just with students, but even just understanding process. Student accessibility services, you know, kind of completely exists within higher education. Whereas for the mental health clinicians, we're kind of walking in 2 different worlds. And sometimes we need help with that second world, right? Like, we know our mental health world really, really well. We're not always as versed with the higher ed world. And this relationship with SAS and with Amanda was really helpful because it helped feed that understanding, which ends up having payoffs for the students, which we'll talk about. This also assisted with other individual campus relationships. We were able to represent each other in different conversations, talk accurately about our services, each other's services, which was very, very important because you never quite know when the services may come up in a conversation with a dean or with a vice president, depending on what, you know, that meeting is about. And I'll let Amanda talk a little bit about some of the things that happened with SAS.
Yeah, thanks. So the timing of this for us individually was really helpful, but in the national sort of landscape of disability resource offices or accessibility offices, professionally, we were navigating some of the changes that came about in the ADA Amendments Act of 2008. So we don't have to get all legal about it, though if you'd like to, I'm here for it. There are 2 federal laws that mandate non-discrimination and accommodation for students. One of those was revised and amended in 2008. And so the ADA sets forward a definition of a physical or mental impairment that substantially limits one or more major life activities as being a disability. And the amendments expanded that definition of what life categories would count. So that list of potential impairments grew pretty significantly. And a big area where we saw that growth was in the area of a mental health diagnosis. So previously, to be considered disabled with a psychological disability, you had to reach a very high threshold of a substantial limitation. With those amendments, that broadened who might be considered a disabled person. And then that coincided with a lot of information from our specific campus, but also nationally in that conversation about student mental health. And so very early on, from the SAS perspective, we've been saying students with mental health crises are students with disabilities and need to be regarded as such, at least in certain pieces. And so while we were navigating that as SAS professionals, it also really sort of necessitated that cross connection and that cross education about how those 2 systems work together. In doing so, we brought all of our SAS folks to one spot. So previously, the Kent campus kind of did what they needed to do. The regional campuses each had an SAS coordinator, but they had probably 5 or 6 other responsibilities along with SAS coordination. And so through that process, we brought all those folks together. We now have weekly meetings. We collaborate with each other frequently. We talk quite a bit about making sure that we're using the same approach to disability, sharing resources, sharing ideas, helping to try to problem solve as creatively as possible, and really working together in a way that was not required, really in any way. And so a lot of that really just came from like great people wanting to do the best thing for their students and working together. And that model then allowed for another sort of example for other offices on campus to think about, all the folks who do this job at the regional campuses and the Kent campus might benefit from talking to each other, and no one has to be in charge of anybody. No one has to make somebody do it, because we all want that sense of community. We all want to be able to bounce ideas off of each other, especially in these two really like specialized situations. And so the timing of that for us was just really, really, really poignant.
Mm-hmm. Another organic piece of what was going on just nationally was, keep in mind that this would have been like 2011, had to think for a second. It's me and that mental math. So we also know that 2011, we were probably about 5 to 6 years into seeing a significant increase of individuals with a diagnosed mental health issue coming to campuses because of good progressive work in treatment and care, in medication advancements, the accessibility and availability of treatment and care, and also just on the individuals and their families accessing care, identifying that care was needed. This is also around the time when we were seeing IEPs in K through 12 systems also going up significantly higher, again, related to some of the changes in ADA that trickle down and have their own version in K through 12, and also in college and universities. So there was a lot of things also going on around us, right, that fed into what we ended up doing. And one of the things that Amanda mentioned that I want to put out there very loudly is that everything that we talked about had nothing to do with reporting lines. So everything that we talk about really was based on communication, intentionality, seeing the value in relationships, building those relationships. And that was what was able to produce some of the outcomes. Like I said, one of the outcomes on the mental health side was that revamp of the Campus Mental Health Coalition, the regional campus mental health clinicians having meetings. But similar to SAS, looking at the model that Amanda had and that SAS had, we looked at that because of the relationship. We could have those conversations of how did you do that? How did you get the buy-in? How did it start? Where did it go? And one of the things that we had prior to me leaving my position was we had a shared manual for all of the mental health clinicians at all of the regional campuses to follow the same basic protocols, have the same types of boundaries with different things, even including in that the understanding that mental health clinicians should not be getting pulled into conversations about a student's appropriateness for an academic program, right? There are existing processes for that. And so being able to keep everyone educated of what systems already exist for students without recreating those things or inadvertently inserting ourselves into places that maybe we shouldn't be was extraordinarily helpful. So, and I'll let Amanda talk about the main reasons why this is so important.
Yeah, so one of those reasons is what Em just mentioned about understanding the resources and the processes that already exist on a college campus. I often tell students, college is really hard and really weird. We do things at college that you'll never do anywhere else. I feel like in high school, we've been telling kids in the K-12 world, like, well, when you're in college, it's the real world. To be honest, and most of you probably know this because based off of your titles, I know you have multiple degrees. You will do things in college you will never do anywhere else. It cannot be further from the real world. And so it comes with its own language, its own processes. Like if you don't know what a bursar is when you come to college, that's okay because you don't have a bursar literally anywhere else in your life. So understanding that process management and navigation with students has been really helpful for both sides. So helpful for M on the clinician side to know more about the way systems work within higher ed, understanding things like withdrawal dates and what grading options are available to students, when they could take an incomplete or when they shouldn't. And then for us on the SAS side, as we're helping students find their clinician, whether it's somebody on campus or off campus, or they're looking for additional information, we then have a little more information to prepare the students to navigate that process. We also were able to do a lot of that cross training to better inform our students. So we would have students who started off seeking out counseling services with M. In the conversations, it would become apparent that one of the areas that the students were struggling with was something academic. And then she was able to tell them about SAS in a way that made sense to them, in a way that was clear and direct, and then easily refer them right over to us, especially for the students who did not have IEPs. So we see, you all know this, I'm very easily preaching to the choir here. The age of onset for a lot of psychological diagnoses is that like 18 to 25-year-old range, which is the age range of our traditional college student. So we're working with students who have maybe never had a diagnosis, maybe never thought about needing accommodations, never used the D word. So if you say, oh, disability services can help you, we hear literally every day, I don't have a disability, I just have anxiety. I don't have was my case. I don't have a disability. I'm just really high strung. So students aren't necessarily connecting that diagnosis with the word disability, and hearing that from the counselor who is maybe diagnosing them or having those conversations about what a diagnosis might mean can really solidify that referral process and help students feel more comfortable with both of those. Also helped quite a bit when thinking about documentation and diagnostic processes. So our office typically requires some type of documentation to establish a person having a disability. We start first with the student's first person experiences, but then ask typically if the student can provide for us some additional information about the duration, the severity, the treatment, maybe some of the substantial limitations that the provider might see, just to give us that additional perspective. And we use, through our office, we have a form that people can fill out for us, or folks can write a letter, provide any diagnostic assessment, things like that. Having that relationship back and forth made sure that we could update our forms correctly on our side. So we previously had a different form for every type of disability, medical, learning, psychological, and eventually we scrapped it and we just went to one form, and we made our regular form broad enough to account for psychological disabilities and for mental health clinicians to be able to do that. It also helps us to know a little bit about what students will encounter when they go to a mental health provider for that initial diagnosis or that initial assessment. We don't want to set students up for thinking they'll just drop by, answer 5 questions, and walk out with some paperwork. You all have standards that you need to meet to be able to diagnose someone, and that may take 5 sessions. It may take a formal assessment or using some type of instrument, or it may feel like a conversation and a couple of hours of your professional expertise to get there. So we want to prepare students for that as well, especially in terms of thinking about the timeline for when they could receive accommodations and what that's going to look like. And then because we had been working together, we were able to, in some ways, sort of commingle our language to be able to consult with each other, and then to help bridge that gap for our students, maybe who had never thought about mental health counseling because they only knew about, they had ADHD and no one ever talked about how those executive functioning challenges might show up as problems in a relationship, right? So those folks never thought they needed counseling. Well, because I can say things like executive functioning, and then talk about how a clinical mental health counselor may be able to assist with that, we could get students to the right place and start introducing some of those languages, those pieces. So, and maybe the first place that somebody heard the word accommodation, they'd never heard that or thought about that for themselves before, but they're hearing it for the first time in that safe space with someone that they trust. So that was, in addition to our physical location of being right beside each other, were some of the reasons that we really felt like that was important.
There was also significant payoff, I think, I'm hoping you're seeing the payoff for the students, in these examples, but there was huge payoffs for the offices. When each office was able to more accurately describe each other's services, including the limitations of each other's services, that really assisted students with having an understanding of expectations. And that always helps any kind of service-based office when you have students coming in that will understand. One of the main conversations I would have with students is, we can fill out this form and it's going to include X, Y, and Z information. However, the accommodations you get are going to come from a one-on-one conversation with Amanda. I do not have control over what accommodations you get. And that's it seems very small, but it's a very important piece of helping students have appropriate expectations for as they're moving through your system, right? Whether it's going back and forth. And sometimes when we talk about consultation, there would be times when Amanda and I would talk and she would ask, without giving, using de-identified information, would consult and ask, well, on the form, it's saying this is the diagnosis and this is listed as symptoms. Do these seem to go together? And there were times when they maybe didn't. And honestly, there were times when I would just look at a form and be able to tell what it said, because sometimes they're handwritten, and I just had more practice reading psychiatrists' handwriting and nurses' handwriting and things like that. But I was also able to share on my end to help her work with students a little bit more about medications. And there might be things where, maybe there's a certain diagnosis going on, but they're on a medication that has pretty severe side effects. And so it's not maybe so much the student's mental health diagnosis that's causing the impairment, but there may be something connected secondarily to the medication they're taking to help them manage their mental health symptoms that's actually having the impact in the classroom and with their academics. So being able to help identify those or highlight those when I would do paperwork with Amanda, or to send over to Amanda for SAS services was definitely beneficial for her, because that's not something that always comes up when we have these conversations about someone's care, is the impact, right, of medications. So that was definitely a huge benefit and payoff, I think, for us. And over time, our students became very positively savvy, and not in a manipulative way savvy, but very savvy with how to navigate services.
And do you want to go to the next slide?
Yeah, my bad. So there's even more of the payoffs. Got ahead of myself. So now you have your well-informed, appropriately system savvy students. And again, appropriately savvy, not in a manipulative way, not trying to get everything they can get out of the different offices and services, but they understand which office to go to for what thing. And that's a huge time saver for everybody. That's a time saver for you. That's a huge time saver for students. And it also helps students feel more confident as they're navigating the systems. Like I mentioned before, this also helps to enhance the students' understanding and respect of those expectations and responsibilities of the different offices. What we also found was, as we talked to offices, honestly, at other locations and other universities, we found that there was often, at times, a disconnect between accessibility services and mental health services because they didn't understand each other's role. And sometimes it really came down to, remembering as the mental health clinician, I'm there to assist the student with being successful by assisting them with their mental health issues. Amanda's office is there in accessibility services to provide that access to the educational materials. And so there's not, and that's her judgment to make those decisions about the accommodations. We ran into several situations where sometimes mental health clinicians, and again, this was on campus, off campus, different institutions, community folks, thought that by filling out the SAS paperwork, they were supposed to state what accommodations they would approve for the student or that they wanted the student to have. Once they had a little bit more education, it really helped with communication among the providers to have that understanding of, we provide all the information. There may be things that we suggest or we feel would be beneficial, but we also had to recognize that we don't know all the ins and outs of all of the different potential accommodations that a student, could have. We're only dealing with the mental health side of things. As with someone we're going to talk about here in a little bit, there may also be medical things that need additional assistance. So that education piece was really, having respect for responsibilities and roles is going to help any relationship really grow. This access to a feedback loop was really helpful, especially when we had students that started with one and went to the other, sometimes came back. It was very interesting, especially the first few years as we were kind of working out the kinks in our processes. If there was something that happened with SAS that a student didn't understand or sometimes wasn't super satisfied with, if they were in session with me, because that was a safe place, they would sometimes bring that up. Now, because I knew enough about SAS services, sometimes that could be more helping them with information, helping with understanding. But then I could also provide Amanda with feedback of, hey, I've heard X issue come up a couple different times. I'm wondering if maybe there's some wording on a document we want to look at, or this seems to be coming from a certain college that maybe we want to have a targeted conversation with, things like that. And back the other way. There were times when Amanda would hear about things from students that was appropriate, to get feedback about from doing intakes with counseling, or wanting to find counselors or an off-campus provider that then I could assist with. Now you also have that reliable partner for that systemic advocacy that we're going to talk about. And again, being able to talk about each other's services in a very intelligent and swift way is very beneficial to everybody involved. Because again, you may be in a meeting as a mental health clinician that's very focused, or you think is going to be very focused on mental health, but what comes very quickly into focus is that typically SAS services is highly connected to those students being successful. You really can't have one without the other. Now, of course, not every student who's in counseling is going to need or want accommodations, and not every student who has accommodation has a need for counseling services, but there is a significant amount of crossover. This was also nice to have a trusted resource and support for a student. Because Amanda and I had a really good relationship and we built trust with our individual students and we trusted each other, we were able to talk about that very honestly with students. If I had a student who I felt very strongly needed to access accommodations, but was very nervous, worried about labels, worried about family finding out, or, well, what are the faculty going to be told? And I don't know that I want to go through this whole story again, right? I could work with them and let them know, not only do I think these services are appropriate and beneficial for you, I know Amanda. I know that she's going to be respectful and she's not going to ask you things that she doesn't need to know, that she's only going to ask you things that she needs. There were even times, I think a few times, that I sat in on meetings for students the first time meeting with Amanda just as a support. And on the back end too, Amanda would many times have students who had accommodations but didn't have a mental health provider. And because we knew each other, she could say, but I know Emily, like, you will be taken care of should you consider going into counseling with her. We can then also be voices for each other when we're not there. I feel like now a lot more places realize that relationship between the mental health services and accessibility services, but there's also a lot of places that don't get that just yet. So you may be separated into meetings, separated out into different meetings. And again, you can be the voice for the person that's not there, for the office that isn't there. Because really what you're doing when you advocate for either SAS or mental health services, you're advocating for students. And now you can do it twice as much, which is always nice. And like I said, that payoff, all these examples are for the individual students, which is why we're all here. And then the payoff for the departments is kind of a bonus. Some of the things that we saw, I was thinking about this yesterday, Amanda, people talk about funding, right? And that tendency to want to be maybe a little bit territorial about money and funding and things like that. But through our relationship, one of the things that we chose to do is counseling services. We had a pot of money that had been gifted to us. Because of my relationship with Amanda, she felt comfortable coming forward and talking about the peer advocate program. And we actually used some of the counseling services money to fund and support having multiple peer advocates on the campus because they were needed. And because them being there and available to assist students with their different needs was good for the students' mental health and psychological well-being. So you can find ways to share funding and support things that you might not have originally thought of that is still beneficial to both offices.
There's a definite upside to like sort of having a foot in both camps. We see a lot of grants and funding now for mental health on college campuses because we know it's a big issue, right? Being able to use your appropriate level of judgment to use some of that funding for, like Emily mentioned, maybe something a little more accommodation or student support related is helpful. On the other side, we have some federal laws in our back pocket. So when you talk about students with a psychological diagnosis as students with disabilities, you now have an additional kind of mandate to why you need to have these services on your campus, or to really like sort of pushing the envelope maybe with administrators or with folks who don't maybe see that connection automatically. I don't like to lead with federal legal compliance as a reason why we should be accommodating people and creating an equitable educational system, but don't worry, it's there. And when you need it, it can really be a secret weapon. I see that somebody in the chat has asked about some resources about the ADA changes, and I'm happy to, I'll try to put some links in the chat as we're going here, and also happy to provide whatever information I can about that. Because that just having just to know that connection will come in handy at some point for you. Our next piece of this is just really to talk about, we had a student who sort of embodied all of these things. We've had many over the years. This was the first student that really felt like, just like, if this student embodies the challenges of being a college student with a disability, we noticed systematic issues that were going to be a challenge for this student, individual barriers, some disability related stuff, just a lot of different things where together we were able to really support the student. So this is a student who was already at the campus before we got there. Many of you, if you work with folks with disabilities, you know, sometimes our students need more than that 4 years to graduate. Why the national average to graduation for a bachelor's degree is 6 years. So please normalize that amongst any college students, you know, or potential college students. And this student was going a little more than part-time each semester. She'd also had quite a few medical challenges. She identified with our office because primarily, if you would ask her, what is your disability, or which office do you feel like makes the most sense for you, she would have started with SAS because she had a significant physical disability. Through working with her, we learned that part of her K-12 experience was, rather than folks educating her about her rights and her own body and her own health, they just sort of did things for her. And I'm sure it came from a great place. I'm sure that people weren't trying to infantilize her, but what it led to was somebody who was legally an adult who didn't know or didn't feel empowered to be able to advocate for herself appropriately, and didn't understand what was a personal responsibility, what was an institutional responsibility, where there was a resource to support, all those different pieces. And that stuff is hard enough to understand for any college student, or for somebody who has access to parents who went to college. This student didn't have any of those resources. She was a first generation college student. And so Em and I really kind of, once I started working with the student for her accommodations, realized that there was a pretty significant mental health component to things, if for nothing else than just sort of managing the stress that is being a disabled college student. So it can say, we talk a lot about bandwidth. We have a public health scholar who writes about how much bandwidth people have. Disabled folks have less bandwidth because being disabled takes up a lot of energy. And so for this student, she was often sort of quick to be angry and to not be able to really helpfully articulate her situation and what she needed. And so she was sort of brushed off by other offices because she couldn't communicate with them in a way they were expecting. And they didn't necessarily have the time or the resources to figure out what she actually needed.
Amanda, do you think it would be fair to say that other offices viewed this particular as a problem student?
Yeah. Mm-hmm.
Yeah.
And in particular, she was my problem student, right? Because you send her to the disability office, they'll handle it. Folks that work in disability services, you know, that is often the way students that we work with are regarded on campus, even from folks who are trying to do the right thing. There's a lot about disability that feels very like mystical, like, well, I don't have the proper training. You probably do. It's probably fine. And so this student was coming to me we realized pretty quickly that she would really benefit from some mental health services because of some of her negative interactions with the medical system. She was pretty hesitant to even talk to anybody else. She sort of felt like, you know what, I have enough people that don't like me. I don't want more people. I don't need more people. I'm going to do this on my own. We were able to leverage my relationship with her to get her to see Emily, to start having some of those conversations, to figure out, you know, what of this is sort of like normal college student development, figuring out stuff, where she needed additional support and accommodations. And then she was able to kind of pop back and forth between us to talk about some tactics for managing her stress and her emotions, and also to talk about additional accommodations. So an accommodation that we have sort of, I don't want to say on the books, but like that we routinely offer to students is an attendance flexibility accommodation. That accommodation was often used for students with a medical disability. This student was one of the first students where we started talking about that accommodation to support her because of her mental health. And we had a conversation about, you know, maybe from the clinical side, providing a student the opportunity to opt out of a class on a really bad mental health day may feel like you're allowing that person to, you know, not confront their issues, not work through it, not kind of use all those skills. But on the academic side, that's how the disability is showing up right then. And while you all on the clinical side, and so this is a very specific conversation we had, Emily is working with the student on strategies to address when you feel so depressed you're unable to get to class. In the meantime, the student is missing class. The student is being penalized for that. So we talked about how we can use that accommodation, even temporarily, but sometimes ongoing, to balance that out, make sure the student wasn't penalized academically for the classes that she was missing, and then also help her balance the additional stress that came from feeling behind, feeling like she couldn't get caught up with her classes. And then just kind of thinking through all of those pieces of the different resources. So when she needed tutoring, when I needed to contact her instructor versus when she should be talking to her professors. That sort of appropriate level of intervention piece was a learning experience for all of us. The student was very accustomed to someone else doing it for her, which again, I'm sure those were very well-meaning folks. In college, we tend to expect that the student is the one who does their own self-advocacy. Well, students don't just show up knowing how to do that. So it was a learning process for her. And, you know, sometimes, especially on the academic side of things with implementation of accommodations, sometimes we do have to get a little forceful or to say, hey, this is disability related. You don't need to know all the backstory about why the student is asking for this. You just need to know that I'm telling you it's a reasonable accommodation. So I'm going to need you to do it. Mm-hmm. And so knowing when each of us needed to intervene on behalf of the student versus when we could kind of push her to do it herself, kind of build those skills and that confidence and that own self-efficacy it took the whole time that I was there. Yeah. She graduated shortly after I left the Start campus to come to the Kent campus with a bachelor's degree. So it was a very exciting time for all of us. We both got to be there for commencement, and Emily got to be there behind the scenes at commencement to make sure that her participation in our commencement was an enjoyable experience for her as well. So I don't know that the student would look back and say like, oh, they worked together and that's why this was successful for me. But that's okay. Honestly, like, I feel like most of you probably relate to this. Like, I'm not here to do this work because someone's going to recognize me and pat me on the back and give me a certificate. Most of the time, I think the most positive impacts we have on students are things that they realize later, or ways they help other people, whether it's their peers or, you know, their siblings or even their own children, to navigate processes because of something that they maybe learned from us. And so we don't need that individual recognition, but for us, it was a good learning experience and a good foundation for what it can look like for when students need both of those services, how they can work together and why it's so important. Mm-hmm. We often say most people don't need both services and they don't need both services all the time, but the ones who do like really, really need that. And they are best served by a team of folks, which is not always the structure that is presented in higher education, but is something that is definitely doable through those those connections.
Mm-hmm. And I can share that on kind of the mental health services side of this story, not only did this individual have a clear physical disability, they were also struggling with significant trauma. They were a victim of several different kinds of abuses, which is also unfortunately something that we know can happen in the community of those with disabilities. They were also the member of multiple marginalized groups. So she had a very complex life, and that all came with her every time, you know, she came on campus. And just to kind of illustrate the progress that was made, we went from pretty significant behavioral problems in class. It's the nice way of saying a lot of yelling, a lot of inappropriate language, and not because she couldn't cognitively express herself. It was that mix of suddenly being in a system that did not have the supports she was used to, was not provided the opportunity to learn how to advocate for herself and communicate appropriately with these different types of offices and peers. To, over time, we really worked out a very, very positive process for her, where by the end, like, and she would, if she would talk to Amanda and then immediately request to speak to me to go over the whole thing again, or if one of us wasn't there, she would just see whoever was there kind of by de facto. And the first probably year, there really was no delineation between the two offices. She really, truly didn't have an understanding that we were, I think, sometimes even two separate people, but really didn't have an understanding that we could provide and support different things. Now, by the end of her tenure with the campus, she knew exactly which questions she needed to bring to Amanda. She also knew where that line was, where she also now understood, knew, and did things first before coming to Amanda with an accommodation concern. So by the time she did need to come to Amanda, it really truly was something weird or wrong had happened in the process. And I'm just thinking of kind of her last 6 months in a math requirement in particular that had to be kind of figured out. That was not the student's fault, but you know, she really needed an additional person to advocate for her on that side of things. And then on the mental health services side, like I said, it started with a lot of yelling, a lot of being loud, a lot of kind of forcing oneself into other people's space. She had gained and learned enough skills to take care of herself. She knew and was able to translate those things to being on campus, which was really, really important. And she was able to, again, by the end of her tenure, she would be able to come down and tell our secretary exactly who she needed to speak with. She was able to articulate, even when she was upset, if she had a question that needed addressed or if she needed to like talk something through. And at the beginning, it used to be you kind of had to respond to her pretty immediately. Whereas by the end of her tenure, she had also learned the skills to kind of keep herself decompressed and appropriate until she could get into that safe space with me. And that was a huge amount of progress. And let me tell you, I'm not an overly emotional person, but that is the commencement I cried at. With taking the extra steps to make sure that she could be on stage. She asked me to come with her backstage, which for me was a huge honor to make sure that it went well. And she also found me later and asked to take a picture with me. And I was lucky enough to talk to her at commencement and hear, you know, that she was thankful and she was seeing, you know, why she was successful and the changes that she had made. And that, yes, she had a bachelor's degree, but she had also learned these other things. And at that point, she was transitioning into other off-campus services, right? She had medical aides at that point that she now had better relationships with. And she also better understood what she needed out of a mental health provider and how to advocate for that and ask those questions to get the services that she needs. So again, like Amanda said, most students will not need both of our services all of the time, But those cases where they do, they really, really, really do. And that relationship between the offices is just as important as the individual offices' relationships with that particular student. So now we want to talk a little bit about, we've hinted at this here and there, systemic advocacy and how you can kind of get to this. So you've heard me mention a couple different things prior. One is the idea of advocating for each other in meetings we aren't both in, either because one of us didn't get invited, or at least on the surface, it maybe didn't seem like it would be applicable to both of us. And again, honestly, by the end, it really was. Pretty much anything that came up about accessibility services had a link to mental health services in some ways and vice versa. This also allowed us to also be asking questions on behalf of each other. And this usually fell into a couple different camps. Policy was a big one. And I distinctly remember being in meetings and when policy was being discussed and asking those questions, well, how does this, you know, what is this going to do for accessibility purposes? Has that been considered in the writing of this policy? Do we have the appropriate wording? And I know that Amanda has asked questions in other meetings about, well, how does this affect the funding of the two different offices? Because if you're going to talk about two funding issues on a college campus that sometimes people don't understand, is we're not going to be the moneymakers. And being able to advocate and remind other offices and other services that that's not our purpose is very helpful and very impactful. Again, being able to explain each other's role when not represented was able to save, I mean, to me, I don't know if Amanda's going to agree with this, but to me, this was the piece that was the biggest time saver for so many reasons, because instead of having to say in a meeting, well, we'll have to ask accessibility services about this. A lot of times, if it was a basic question, those are things I could answer and keep moving the conversation along. Because we had our relationship, after those things happened, we were immediately telling each other. So we were making sure that each other was in the communication loop of, hey, so I was in this policy meeting about academic forgiveness. And this question came up, here's how I answered it, but you may want to follow up again, or you may want to ask to be in the next meeting. So those communication loops are really important. And again, that helps build that trust in the relationship. We also found, and this piece took a couple years for even us to figure out. So we can't claim a lot of pride on this one, but we also started realizing that sharing our data and presenting our data together was very key. Initially, SAS and mental health services were very separately presenting data of, office traffic, diagnoses, how much time is being spent with students, student outcomes, all that stuff. But we were having the discussion separately. And what we realized over time was that really actually bringing those two pictures together makes it much clearer, because now you're bringing together the data points of X number are coming to counseling or psychological services or wellness services, whatever you call it. But SAS is seeing this percentage of students with their primary diagnosis as a mental health one. And what you would see is that a lot of times there wasn't a high percentage of overlap, over even with the greatest of relationships, we weren't truly sharing that many students. Sometimes it was one-offs just to get them enrolled in each other's offices. But by bringing those data points together, it also helped to show that the mental health and wellness of students is not a one office responsibility, right? We have to approach it from those 2 points of views of not just helping them with the mental health piece and their stress and their coping skills and their ability to function, but we also at the same time need to address and support their academic identity. You can't silo those two. It's when you silo them that students really are the ones who struggle, and you have to bring those together. And I think that was probably one of the last pieces of systemic advocacy that we really figured out in the last few years. That included bringing those data points together in large scale reports that went to university leadership. So it wasn't just in siloed conversations at different campuses. It was collectively bringing that information together and presenting it to leadership, which included also, you will all appreciate this, the numbers of students served and then staffing. So that was another way that we were also able to put forth, if you're going to open up more mental health services, there's the possibility that more students, that's going to be an access point for SAS. And so we need the staff ready and available to be responsive to them to address their academic identity concerns while they're also getting mental health treatment.
It was especially timely for my office that just added 5 staff members, because over time, as folks have left, if you know anything about higher education funding, it's not a great time for us. So we've lost folks just through natural attrition. We haven't been able to replace them, and being able to rely on some of the work that Emily did when she was here, with campus and university-wide mental health information, and then the addition of a mental health component to our student fee, then meant that our office could increase our staffing to be able to be available for those students. We've been adding direct service providers in our counseling and psychological services office for a little bit, which has been great and super helpful for our students to get the support that they need right away. But the piece that was missing 10 years ago was that connection to our office, and what that means for the staffing and the needs of the students in terms of helping them navigate their academics. And so it took a while to set that stage, but to really like drive home that point that when students are seeing a counselor, if whatever they're seeing a counselor for is impacting their academics, they should see SAS, be considered as disabled, especially when you're thinking about unenrollment. So, you know, the idea of like maybe if a student shouldn't be here right now, considering that is a person who would be maybe a disabled person. So you have to think about the discrimination aspect as well. So I'm very excited about it. And Emily was probably the first person I told when we got approved to do it, because it's been such a long process, but totally pays off in the end to be able to share that information and those trends.
Right. And as a reminder, now that SAS is able to be more responsive to your students, that's going to also alleviate stress, anxiety, and assist with some of the mental health things that they're struggling with. So again, we're seeing where they're so interconnected. And it's so unique when you work at a college campus that you're working with folks that have that academic identity. And that's something we have to work on. There were 2 other examples that I wanted to bring up specifically about this systemic high level advocacy. One is very pandemic related. As the pandemic was starting back in 2020, I think I was pulled on because Amanda said so, if I'm remembering correctly. We had an academic continuity committee for the university to look specifically at academic policies related to the pandemic. And I believe, again, originally I was not asked to be on that committee, but Amanda advocated to have me included because part of my role was, you know, you can talk about academic policies and put them on paper, but what I was able to talk about was, listen, we have a whole pandemic going on, and here's what's going on with the mental health of people in general. Here's what's happening related to grief and loss and fear in a nation that has never gone through a pandemic before. So to bring that perspective and be able to utilize that perspective to make, I personally feel, better decisions for academic policies during that time, many of which have continued. Because we saw that they ultimately were more supportive of students. We had just, I say we collectively as a university had not been put in a situation where we really got pressed to either justify what we were doing or justify what we were not doing. And in some ways that was a kind of a weird silver lining to the pandemic, was that this committee occurred and we were able to do that. Another piece that came out of this was the last year of my tenure with Kent State, or the last 2 years, I worked on a project for that addressed mental health and well-being of students across the entire university system. So this included all of our domestic campuses and our international campuses as well. And what came out of that research, survey work, talking to students, doing internal assessment of our services, came a published white paper with a framework and plan to address mental health and mental well-being of students, which included student accessibility services as a specific service that was noted that needed more support, that needed, more assistance to meet the needs of students, because we advocated that these services, the academic accommodations, are part of student mental health and well-being. And I really don't know that without my relationship with Amanda, my relationship with SAS, that I would have inherently, again, had that insight to bring that forward. So it is included, not just as a thought, but specifically cited in that white paper. In addition to that, what also is specifically cited was our CALIA certified police department, and making sure that they had training in crisis intervention and mental health issues to better interact with our students when they should go into crisis. So again, it was bringing in these other pieces to get the most holistic and comprehensive view of how to really help our students through collaboration.
We have some tips for you all, and I'm going to try really hard to not just keep talking forever, so we have a little bit of time for questions. So a big piece of this for both of us was just really putting in FaceTime and talking directly. So Emily and I shared an office space. We had a shared clerical support person who the three of us did a lot of things together. So it was easy to do in those circumstances. But even for as much as you'd think, oh, well, of course you're close together, of course you'll talk, that intentionality behind it really was important for us to schedule time during our workday to sit down and plan out what things we would talk about. We'd think about things from the student life cycle perspective, thinking through intentionally, what do we each need to learn about each other? What have our students brought up to us? Those kinds of things. For a long time, we had almost like a standing update meeting where we had set aside that time to do that because it became pretty obvious that it was necessary, in addition to just helping us both feel supported as new employees at a place that we hadn't been before. A big piece of it too was being willing to learn and to be cross-trained. So being able to be respectful of each other's professional identities, but also bringing that identity to a place of saying, I don't know what you do, or I know what you do because I've been on the student side of it, maybe, but I don't know what it looks like now in this context. Being open and transparent about processes and expectations for us was really essential as well, and kind of being able to check each other on what is your expectation? Is that an appropriate expectation? And then also thinking about that from the student standpoint of what are the students' expectations? How do we help them manage that appropriately? And just being able to say to each other, hey, this process doesn't make sense to me. What's going on here? Help me understand this more so I can explain it to students. That alone led to conversations about what we could do differently ourselves, but then also reasons why certain things were happening, right? So students couldn't just walk into M's office and immediately start seeing her as their counselor. She needed to do information at the beginning to understand who they were, make sure that they, were eligible for services, that she was an appropriate clinician for her, all those things. So on the student side, it feels like, well, why can't students just walk in there and get some counseling? Once you understand that, it makes so much more sense that when you're working with a student and you're helping them try to use counseling services, to be able to explain, well, your first step is going to be this, and here's why this is really important. And then your next step is this, and it's going to look like this. To sort of demystify that on both sides for students who aren't used to doing that, for both of us and for our students was really helpful. Another big piece for us that we both sort of, again, intentionally sat down and talked about was understanding confidentiality and privacy. So if you're in the higher education world, you know about FERPA, the Family Educational Rights and Privacy Act, essentially says the student is responsible and the only one who has access to their educational record unless they provide that information, that permission to someone else. So it's why we can't talk to parents, which comes in handy quite a bit. It can sometimes, though, too, also mean that as a FERPA required employee, I can't share information with other people unless it's related to them providing an educational service. So if they need that information to educate that student, I can share it. Emily, obviously, is dealing with FERPA on the student side, sort of minimally in terms of who's a student, who's not, what's going on. But then the big piece for her is HIPAA, as many of you I'm sure are also aware, that comes with a whole different level of confidentiality and reporting and security and all of those things. So being able to understand for each other what we could share, what we couldn't share, and then also knowing like, so M can't share this with me about this one student situation, but it's not necessarily about that student. I have a question about a process or maybe a resource that might help a student who says this kind of a thing. So we could get information from each other in a way that was helpful, allowed both of us to be able to provide the level of confidentiality and privacy that our students were entitled to and have the right to expect from us, without either one of us feeling like we had to, to compromise any professional integrity. It also helped too, then when we were talking to other people, to be able to say, well, M can't share this. Or if I saw a student even in my lobby area that wasn't coming to see me, I wouldn't talk about that with other folks. Like, technically I probably could, I'm not a counselor. So like, if I see somebody in the space, like I'm not violating anything, but it's also just like, it's kind of not cool, right? Students are there because they want that confidentiality. So being able to know when we want to be extra private, knowing when we don't need to be as private as we think in terms of thinking about what we can share with faculty. They might think, well, if this student needs counseling and you can't get information about what they're talking about in counseling, but I can talk to you about the effects of their disability in the classroom as part of their accommodations under FERPA. So you can call the office and you might think you're going to talk to M, but you might end up with me, and I can give you a little bit more information to be helpful, because we have that sense of who can share what and when, and being respectful of that on both sides. A big piece of that too was openness for feedback and communication. Our friendship helped certainly with that, but that intentionality too of checking in with each other, using each other as a sounding board, really helps that piece as well.
So some other tips for collaborative relationships, and honestly, these are things that Amanda and I did, but I'll be honest, especially this particular list, these are the things of, if you either don't have a relationship with an office, or maybe it's not the relationship you want with an office, these can be some good kind of fallback. Like if other things aren't working, these are kind of the basics, right? And really where we are, everything should be, every focus should be on the student, right? The reason these offices should be talking, the reason these offices should have positive, transparent, helpful relationships with each other is not to make our jobs easier, though it does. It really is to help those students be successful. And sometimes when we get off into the weeds, or sometimes I've described, if you kind of run into maybe like a little bit of a bulldog on your campus, kind of territorial, this is that common thread that every office at a university and at a campus falls back on, right? This is the question we all come back to, is how is what we're doing impacting students? And sometimes that's the thing that kind of can help bring those groups back to the table, because it's that common ground that we all have. Even groups that you don't necessarily typically would see coming together, bringing mental health and recreation and wellness services, bringing in the Women's Center, bringing in residential services. You might not necessarily make all those direct connections, but all of those groups, all of those people focus on the student. And when things are going awry in a relationship where it's not feeling collaborative, this is a good thing to bring back up to help kind of ground people back in like what you're really supposed to be focusing on, back to the table. Being proactive with the relationship. I can definitely think of examples for both of us where there was maybe an office that didn't necessarily want to have a relationship with us. And boy, weren't we just proactive about that. And sometimes that was including them in meetings, reaching out and asking to meet with them, making sure to follow up on any conversations. Offices or individuals that I knew it might be a little bit more of a challenge to have a positive or collaborative relationship with, those are the ones that I made sure to get that little bit of extra special attention. Like if an email came through from one of those offices, I prioritized that email, right? If that came through from facilities and maintenance, that got prioritized, like if they had a question or if they wanted information. That idea of having professional respect, right? Remembering that we have different licenses, we have different experiences that have brought us into our work. But I could also guarantee that if you're working in mental health services and you're talking to folks from accessibility services, you're going to have some experiences that overlap. My experience was sometimes realizing that, man, I probably should have had accommodations when I was in undergrad and for my first graduate degree. Looking back now, understanding what they are, right? So keeping in mind that professional respect, and respect does not mean deference. It doesn't mean that just because someone has a particular license or has a particular title doesn't mean that they have all the information or are the deciding factor, right? But it is having that professional respect. And this for me, I don't know about the rest of you, but this for me extends to all levels of folks that I work with. I always made it a point that the happiest person in our office was our secretary because her work had a huge impact on the student experience, and her understanding of our offices was also a super important collaborative relationship for us to have with our roles. And understanding the role of the offices and what we each do for students. I know that we have mentioned this many, 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 many times. I can't emphasize it enough. It's just putting forth the time and effort to have that understanding, to ask questions, and to share that information. And remembering that the services that a student gets at one office can relate to what they're getting in another office. And remembering that if they're going to both offices, it's very important to talk about roles and make sure that when you are strong in your roles and boundaries with what you do and don't do, that actually really helps the student, right? That helps the student learn how to access services appropriately. And that's one of those skills that they're going to take out past graduation. And then the last one is kind of the catch-all. We've run into this throughout our professional lives of things that happened in the past. There's, negative feelings between offices, which usually came down to just not understanding each other, or just different situations in the past, misunderstandings of what should have been an outcome. And honestly, by being proactive in the relationship, that's just get over it. Whatever it is, if you can get over it first and then take that into some proactive outreach, that's going to speak volumes. A lot of times what we found was things happened a long time ago, but that information or that preconception about the offices persisted past, staffing changes and leadership changes and things like that. So part of being proactive is identifying if that's part of what's going on. And like I said, getting over it, whatever it is, and just reaching out and giving it a try.
Okay, I'm so proud of us because we still have a few minutes left.
We have several minutes left.
Several minutes 30. And so we'd love to answer your questions. I've been trying with the Q&A. I don't know where those show up. If they're showing up for all of you in the little Q&A box at the bottom, that maybe something is, maybe Ashley or Juliana can tell us about. Somebody had asked about some resources for helping people understand accessibility services. And so I put a link, and if I need to, I can put it in the regular chat too, to the National Center for College Students with Disabilities. So that organization works closely with our professional organization at the Association for Higher Education and Disability. You can go through, it's a deep kind of thing. So you can get a lot of information there. Love to hear any other questions that you have. If you all have experiences like this that have worked well, you want to share something that worked for you. We've got the chat, and then I think we've got the hand option here too. So,
Amanda, would another resource that might be helpful be Ohio Ahead for
yeah, certainly, yeah. So yeah, we don't have a ton of information on our website, but you can certainly reach out if you are interested in learning more about accessibility services at an institution, especially if you are not at an institution. I think I don't want to speak for everybody, but certainly feel free to reach out to Ohio Ahead. As the past president, I can tell you, we would love to talk with you, talk with your organization locally or across the state about what we do, and how we can all work together. And certainly, I think, feel free to reach out to the local folks at your campus, or, you know, if you're in an area where maybe there's a community college and you're a community provider, just reach right out to those folks. They're probably getting documentation from you and will recognize your name, and we'll see that there's a benefit of having that conversation. Our contact information is here, and certainly Em or I would be happy to answer questions for you via email or to provide any additional resources too.
Yeah.
Amanda, you did answer the 2 questions in the Q&A, so thank you.
I wasn't totally sure that I was getting that right.
Yeah, you got them.
I would like to give Ashley Hartman a little shout out, and if I had a gold star for you, Ashley, I would give you that gold star for participating and for asking questions. I love that.
I agree. And I agree, Ashley, this has been extremely, extremely helpful. I'll keep quiet for a few minutes to see if anyone has some questions. Don't be shy.
Yeah, we're not.
Hi, Meredith. Oh, and Barb, KSU friend. Hello.
Stay tuned at the end. I believe Ashley will have a QR code and a evaluation link for everyone to complete. I know I love those at the end of trainings.
Yes, there it is in the chat. Juliana or Ashley, are we able to share the PowerPoint? Is that something you all can send, or
yes.
I can put it in the chat? I don't know what makes the most sense there, but that way
yeah, I can send it, since you sent it to me in the email, I can pop it in the chat right now, actually.
Okay.
If you could wait and pop it in the chat as handouts, because there are some notes that are more kind of internally oriented.
Yeah.
Yeah, of course. Let me, do you send that an email as well, the PowerPoint without the notes?
I can resend that to you, yeah.
Yeah, let's do that. Yeah, just in case. Yeah, our internal one does have a student name and just a first name, but
we still don't want to share that.
Yeah, no.
Correct.
Okay. I want to thank everybody for attending. This was Amanda and Em, this was just fantastic, so informative and so applicable, I think, for everyone here, even as myself as a parent of a child with a disability going on to secondary education. That being said, I just want to let the audience know that OCI has partnered with Med to conduct a survey-based research project around student wellness. I'm going to put the lead researcher, her name, there's a really good chance that she's already reached out to you, but just in case, this is a very important research project that OCI is supporting, because it will give us statewide data on student wellness for the past year and a half, and all those things around it that has impacted it. So there's a survey tool for students, and then there's also a survey tool for staff and faculty and administration. So if you should see an email, and you might want to check your junk, from Dr. Bonfine at Med, please reach out to ask any questions. She's so helpful and so knowledgeable, and she will make this an easy experience for everyone. And again, her name is Natalie Bonfine. Once we have all the data collected as well, we will share it with the state of Ohio and all the higher ed institutions. We want everyone to be well informed.
And like Amanda said, I know I'm the type of person that pretty much as soon as a webinar ends, I think of my question. Definitely don't hesitate to reach out to either one of us or both of us. If you're not sure, we're used to this. If you're not sure who can best answer the question, just send it to both of us. That was kind of our 10 years together. So definitely don't hesitate. Or if you have a situation going on at your campus that you just kind of want an outside perspective on, especially with the crossover of mental health and accessibility, we're happy to help.
Yes, definitely. Please feel free to reach out. And if you're the parent of a high schooler who's going to go to college at some point and you want to talk about it, we do that all the time in the office. So happy to help.
Well, that's great. Now I have a personal resource. You know, it's amazing to me how there aren't more resources for students transitioning into secondary education who have a mental health disability. I'm just amazed.
Well, now that I have more staff in my office and I have like a minute to breathe, that is on the priority list for the next year or so. And then something too we want to work through with Ohio Ahead is just putting that information together. I think any one of us could probably talk about it off the cuff for 45 minutes. So if there are, you know, if you need somebody to come and talk about that, I can definitely get you some folks. Definitely let me know.
No, I will keep you guys in mind, definitely. And if you need an advocate,
Yeah.
on a professional and personal level, I'm your person. So
Yep.
I have a stepdaughter as well who wasn't diagnosed with her mental health disability until she was in college. And then she struggled and struggled, and she is now actually at a new different college. And, you know, she has become her most best advocate. So with some guidance, you know, but she is doing so much better now because the college that she is at finally made the connection between the two offices. And I thought that it was fumbling along doing that, but finally somebody in one of the other offices, and I think it was it was the disability office that said, hey, wait, let me make the connection for you between our office and the student wellness and I. So she's in a much better place.
Yeah.
Good.
Somebody put in the Q&A that was a lot of focus on mental health. Could you speak a little bit about students with substance use disorders?
Oh.
Yeah, so that's a great question. In terms of the disability side of that, if somebody is, we couldn't provide an accommodation for like the active use of a substance. We occasionally get that question like, oh, so if someone's dealing with this, you're just going to let them do whatever? No, but there are, that could certainly also be someone with a disability. So in a lot of ways, it's the same kind of approach in terms of thinking about what's the impact in the educational environment, what are ways to provide an accommodation for that student. The flexibility with attendance and deadlines often helps, especially if they're doing like an inpatient treatment program, an intensive treatment program, or they're dealing with any kind of medication support that can really be a tough time physically as well as emotionally. So those are definitely still folks that our office would want to see. And then there are some places, so at Kent State, we have a collegiate recovery community. So we have on-campus focus for folks that have a history of a substance use disorder. So depending on where you're at, that's definitely something you might want to check in with usually it comes out of the counseling center. It's coming from someone with that clinical license, but that's becoming more and more common on a college campus.
Right. And obviously from the clinical mental health side of things, we often work with students that are either in recovery, working on their recovery, just starting recovery, thinking about recovering. So, you know, we're also that resource for them to assist with helping them to work on the other pieces of their life so that they can stay engaged as a student. And similar to the SIS office, we are also empowered to have the conversations with them of, you know, is college the best fit for you right now? Is there something we need to look at that's different? If a crisis hits, you know, here are your options. Whichever place they find safe to have those conversations is where those conversations can and should happen.
we're at our 3 o'clock end spot, right? So thank you all for being here. Thanks for your questions and your engagement. As Em said, either one of us is happy to answer any questions, or feel free to give us a call or shoot us an email if there's any way we can assist you with what you're doing, and keep doing the good work.
Yeah, absolutely. Thank you, everyone.
Thank you, ladies.
Thank you.
Bye.
Oh, that went well.
I don't know how to stop recording in screen share. Let me stop this for a second.
Oh, okay.